Whether you're managing stress, understanding intimacy, or just need someone to talk to, we've got your back. Imagine expert sessions guiding you through your journey, peer support lifting you up, and interactive resources right at your fingertips. This isn't just about health, it's about empowerment. Break the silence, challenge the myths, and join a movement that's redefining wellness. Let's build a community where every voice is heard, every story is valued, and every individual feels supported. Take the first step towards a healthier, happier you. Visit Pleasure Sutra today and join the conversation. Together, we can create a space where you feel empowered and understood. Because you deserve it.
Good morning. Good morning, everyone. Welcome to our webinar, Redefining Sexual Wellness, Breaking Taboos, Myths, and Misconception. We are so happy to see you all. Speakers, we are expecting few more people. It's being Sunday, people are a little lazy, and the weather is also very, very comfortable. So here today we are going to talk about sexual well-being affecting mental health mainly. We have our esteemed speakers with us. We have Dr. Chinmay. I think that we should can we just share the screen of the introductory screen of all the speakers? Vijayati, can you just share the slides? You're going to do that? Yeah. Yeah. So we have with us Tripti Desai. She is the founder and CEO of Shraddha Foundation. Dr. Tripti, is a professional advocate for breaking social taboos around women's sexual health. She'll discuss how women can navigate intimate relationship and embrace their changing desires confidently. We have Dr. Chinmay Kulkarni, a consultant psychiatrist at Curatus Mindcare Clinic. Dr. Chinmay has over 10 years of experience in mental health. He will help us understand the connection between mental health and sexual wellness. He would talk about common myths regarding sexual dysfunctions, sexual practices for women age 35 and above. We have with us Mrs. Bhiva Chandra, a wellness coach and yoga instructor. Vibhaji specializes in helping women reconnect with their bodies and minds. She will share how yoga and mindfulness can support libido, confidence, and overall well being. We have with us Avni Hemant Veera, a counselor and IO psychologist. Avni has years of experience helping people manage relationship challenges, stress, and body image issues. She will talk about the sensitive topics like attraction outside marriage, body confidence, and fostering open communication in relationships. Many women over age. This webinar is, though I see a lot of male participants, is really nice. Probably this knowledge they can share with their partners, their women family members. So many women over 35 face unique challenges when it comes to sexual health and intimacy. After 35, somehow the life starts to kind of settle in, and we don't talk about things which where we think that we should be talking about, we should talk about, because there is a lack of safe space to talk about. There is no community as such. So then it creates a mental, I'll say not exactly a mental health issues, but yes, that's a disturbing thing which starts happening with us. So we this is a space where you can talk openly, find clarity, and can empower ourselves. Yes, so I have few general questions for all the panel speakers here. The first question is that why do you think wellness is still a taboo topic for women over 35 especially? What can I do to change this? So I would like the speakers to address this. Maybe Ms. Tripti can do this? Can answer address this? Dr. Tripti? Can you please unmute yourself?
Hello, am I audible?
Yes, yes, you are, you are.
Okay, I think I lost the network. So can you repeat your question, please?
Yeah, so I have two general questions for all panelists. The first
Okay.
question is like, why do you think sexual wellness is still a taboo topic for women over 35? What can I do to change this?
Okay. So to begin with, yeah, women over 25 still face
Miss
a lot of
Desai,
stigma and
can you please switch on your camera so that all the participants can see you?
okay, sure.
And then I would request everyone, if it is possible, to switch on the camera as well. Yes, please.
Okay. So just wanted to, first of all, good morning once again to everyone. Women over 35 still faces a lot of stigma and taboos. The stigmas are it's a combination of cultural, societal, and generation factors, and that influences the continuation of shame, silence, misunderstanding, and that prevents women to embrace their needs and their rights actually. So this is I'm really thankful to you and the team for providing this platform and starting this kind of discussion, which is the need of the hour.
Yes. Dr. Chinmay, what would be your take on this? Okay, okay. Acha, you are unmuted.
Yeah. Hello,
Bijoli,
good
can you
morning.
please just, yeah, yes, okay.
Actually, I think only you can unmute.
Yes, yes, yes. Sorry for that.
Yeah. So basically, there are multiple reasons why this happens. Overall, only the sexual wellness is a taboo area in all age groups. But since past 10-15 years at least, we are seeing that at least in adolescence, the society is accepting that, okay, we need to speak about these things. So many times we go to schools or colleges to talk about sexual wellness or sexual education, not wellness, but sexual education. But that somehow stops, and mainly people start watching porns or going on internet and talking to other people, and they start feeling after 35. The problem happens is that overall social misconceptions is that, after having children, women, they are less interested in sex, so why to talk about it, and that kind of thing is there, which is true to some extent. But however, there is another surprising fact which many people must not be knowing, is that women older than 35 years of age may have increased orgasmic potential. So some women might not feel that interested in sex after, say, 35, but not exactly 35 after the childbirth. But a lot of women will have more orgasmic potential. So they start feeling better having intimate relationships. But because these things are not known, some of them who start getting these things also start feeling, something wrong with me. And so that's why we need to talk about it more and more often. There should be more of such psychoeducative uh, webinars, conferences, articles in newspapers, so that women know what is going to happen, what can happen, what could be the problems while happening. Then, so that's why it is important.
I have a question here. this is a general question to everyone, all the participants also. When you talk about that, the women, they don't talk about it, especially like once they become mother and all. But do they really talk about their, the sexual desire, their, uh, their sexual practices, what they like, what they don't like? Do they ever talk about it? Whether it like then they're 35 plus or 35 less than 35. So that's one of the, I think, the biggest myths and taboos with women, no matter how progressive, what kind of society they belong to. What does the research say, doctor?
Yeah, so as far as India is concerned, not only women but even men don't talk that much about it. Men will talk about general sexual things, but their personal sexual lives, what types of experiences they are having, what types of problems they are having, they don't discuss because uh, it is considered something which is inside the bedroom should not get out of there, something like that. So there are so many patients we see, both male and women, and in all the age groups, but especially after 30s, married couples, they are suffering with some sexual dysfunction for many years, 10 years, 12 years, 13 years, and nothing is being done about it because they don't talk about it, and they feel ashamed. How can I speak? Nobody else is speaking about this, not the other women. I'm not sure what are the internal talks between women, but there is generally people don't talk about sexual life, personal sexual life, general things they might be talking about, but especially in men, and the reliance on internet pornography is far more than genuine conversations, and that also is one of the problems which happens because people start expecting unrealistic things, or things which are generally not possible.
Yes. So, Avni, what is your take on this? Because you probably be dealing with, since you are into like, kind of, life coaching also. So what do you see? How do
So,
you like,
yeah, so usually what happen is that both men and women do suffer this, as Dr. Chinmay also correctly said, that whatever in India, it's still a taboo. Plus, if sexual wellness is so much of taboo, even the mental health is. This about not defining your sexual desire, like we women have our own sexual desire, the way the men have it. But we don't openly say it because we feel like, oh, what if this is the taboo? What if my partner doesn't want it? So when I
yeah.
do couples counseling or something like that, the main issue is that only that, the communication is not clear. Plus, how there is an extramarital affair going on. There is always a doubt that, the woman might have it. Ki, what if I'm not able to give that much pleasure to my husband, that he might be going out and seeking? So I feel that we need to break that taboo. As Dr. Chinmay also correctly said, that it is getting more awareness in adolescence, but it is also going in a very wrong direction because the parents are not able to psychoeducate the kids on how to go about the sexual wellness or to have more knowledge on the sexual part. So yeah.
Okay. Okay. Good. These are like, really, really insightful. Bivaji, what's your take on this? Because you've been like, I mean, doing, you have a huge group of women who are like, exactly fits into our target audience.
Thank
What
you.
do you?
Thank you, Mona Lisa. Mona, I was just listening Chinmay ji and Tripti and the other one. The thing is that we talk on these issues. And we are not ashamed. We talk on shallow notes. Exactly what I want to say, if I'm able to make you understand, that we talk on these issues, but on the shallow notes. Today itself, when this webinar was about to start, my husband was just forwarding it in every group. His engineering group, his this means various WhatsApp group. The person that were joined with him since last 40, 50 years, 40 years, I can say, from his Rudki days, engineering days. They all were talking on this topic, but on the very masti wala note, I just want to say that it was a shallow notes. So people are talking on these issues, but they are not talking correctly. We are here, we four as a panelist are here to talk on these sexual issues that are going on the in the wrong track and bring it on the correct track. So I just want to, as a yoga instructor, I will tell in the coming hours, coming minutes, I'll tell about the remedies, what we can do. But the thing is that presently we have to talk it on the correct notes. The thing is that I want to explain here. Thank you, Mona.
So do you think that, the men are more stigmatized about this topic or the women are?
No, Mona, exactly. Men and women both are not talking correctly or not talking openly. Men are also not talking openly, even with their wives also. Wives are vice versa. Wives are also not talking to their men, but they are talking with their fellow persons in a very
Yeah, yes, I get it.
large amount and in the correct, not in the correct direction. They were saying your wife is on this issue, talking on this issue. You are 60 plus. Are you going to explain me some other topics, some other points on this that we can have pleasure at 60 plus? This is not at all the point of pleasure. This is exactly the point of that we are misguided. We are not able to cover ourselves mentally. So, as a yoga instructor, I'm very amazed that you just put up this point. As a yoga instructor, I was talking on the physical issue, I was talking on the mental issues, I was talking on the spiritual issues. But my yoga practices do help in the sexual issues also. This I want to emphasize. So
Right.
later, when you're going to give me time, I will just talk
Sure,
about
sure,
more on these
sure.
issues.
Thank you so much for being so bold, actually, Vivaji. I think that the women should come to this space to talk about it, actually. The corrections should start from home. That's what I believe.
I was amazed. I was not amazed. I was surprised that my husband's friends are all from the Roorkee, IIT Roorkee, and such a talented, such a good persons are there. But on these issues, again, they're talking on the shallow issue, shallow level.
Yes. So, Bibaji,
That
that's the mindset. That's what
sorry,
we have. That's what we offer in our platform. We need to change the mindset. So, my
sorry
second
to say,
question is that my second
Mona,
question was, yeah.
sorry to interrupt you. अभी ना various friends are here on the in this on this stage. My husband is also joined, and they may be amazed at what this lady is talking about. So sorry from this.
I hope that if the peace prevails in your household after this conversation webinar is over. Okay, so my second question, my to all panelists, what is that one common myth about women's sexual health that I think that we should address or try to correct today at present scenario? The biggest myth, probably. Is it the physical thing that we have? Like I hear this common thing. The mothers, I mean, at our age category, that one is the vaginal dryness, so that they are not being able to satisfy their husband, and sometimes like they feel no, our children have grown up, we should not do this. I have seen this. This is a very very no, हमें ऐसा नहीं करना चाहिए, बच्चे बड़े हो रहे हैं, अरे वो क्या बोलेंगे क्या सोचेंगे. So what is you think that is the biggest common myth which we should address, we should try to correct?
Uh, According to me, the most common myth prevailing now is as the woman gets older, her sexual desire decreases, and it should get decreased. Now, this is a major myth that leads to a lot of frustration in women, lots of fear and guilt. Because of this myth, they hesitate to discuss about their sexual needs, about their sexual health, with even to their healthcare providers in an open manner. And this needs to change. This is the myth that I think needs to change.
Okay. Okay. And then Dr. Chinmay?
Yeah, so as Trupti ji said, and as I told earlier also, that biologically some women or a large number of women will have more increased orgasmic potential after 35.
Hmm.
Now, if you have been told all the time that, okay, it's okay to have sexual desires, but that is for young people only. Once you become little bit, you go towards little bit of middle age, 40s or plus that, then this should go in background. Where you obsessed with something with children or adolescents are obsessed with, and then you start feeling that is it something wrong, because most of women don't know this, that biologically this can happen. So then they start feeling that is means those women who are feeling more sexually active after they become 35 or 40, then they start feeling is something wrong with me. But now they can't discuss this with anyone apart from their partner, because they might feel that people will judge them. If they talk to their friends, even female friends, they feel that, okay, this friend of mine will tell my other friends, and they will all gossip about it. And what if this is something wrong? And they start feeling extreme negativity, that people might start thinking that I'm somebody who is obsessed with sex and all of this. So this is a natural thing which is happening biologically, this is happening, and there's no shame in it. And if
Right.
unless they are not doing something
Hmm.
unethical, or unless they are not doing something that is going to trouble their partner, it's completely normal. But because of these myths, they feel ashamed of themselves, or they feel ashamed, okay, something is wrong with them. So I think that
Right.
is one of the main myths.
Yeah. Okay. Thank you. Thank you so much. What do you say, Avni?
I feel it's the myth only because, as Dr. Chinmay and Tripti ma'am also said it correctly, women also think about it. Plus, when we learn in psychology, we feel that, our libido goes down or how it affects us. So, plus, a lot of things are kept in the bedroom only, like abhi bacche bade ho gaye, what will they think about it? How to, portray these things. So I feel that women start thinking from a lot of different perspective rather than just thinking for their own sexual desire in a mental way.
Okay. Good. Thank you. Vivaji, do you have a point on this? What is your observation on this? What is the biggest myth you think that the women?
Mona, I just want to speak in some other way this point that we should not feel responsible that only men are not on the right track or something like that. Even women, we women, just do not dress up. If you have heard, everybody have heard about the word pheromones. Pheromones is a type of hormone that is being secreted by the animals to attract their counterpart. So we women used to dress up only for a marriage party, only for outing, only for this thing. We never used to dress up ourselves when we are at home. So this is also a point that the attraction between two persons go down, or we can say when we don't dress up, we don't externally we are not ready. Then also our libido goes down. So my point is this thing that women also should try to give their helping hand in these things. Thank you, Mona.
Okay. So now we would. I mean, I myself have a question actually. I see. I mean, now we are talking about only like the women who has a confirmed partner, or like so kind of the husbands, or like I mean a boyfriend or whatever. But there are a lot of women who are single and who are kind of like after divorce or after a breakup. What about them? Is there I mean, is it that the kind of this, they're not being sexually expressive, or they did not ask for their, they could not express their desires? Is it like, that's why their personal relationship is getting affected? Is there any correlation to that? Maybe that they're like too tabutized, too stigmatized. And then how do they express? Isn't it like their mental health is in questions? Yeah, maybe
Yeah.
Tripti ji,
So,
you can put, yeah, okay. Yes, doctor. Yes.
yeah, so basically, there are two, three things here. One is that uh, the problem in Indian society is that if there is a woman who is 35 plus who is single, she might be separated, divorced, or unmarried. There are so many men who try to approach that woman. So this woman already is quite scared uh, because she doesn't want to have some bad experience, and she has desires herself. So I have at least seen, I think in the past 1 year, I must have seen 3 to 4 women, single women, above 35 or above 40, who had same problem, and they had their own sexual desires. So they wanted some partner or somebody, but because of this excessive attention which they were getting, they could not make good choices. So some of them went in relationships and understood that the men who they got in a relationship were quite bad, or they were just there for their physical or sexual desires, and they had no desire whatsoever to continue this relationship for a long term or get married or something. Because of that, all these women went in depression, and they had to means they came to me. Just last week, I saw a woman whose husband had died some 20 years, 15 years back, and she was young, quite young when she got married. She has a child. She just 21. She was married. She got married, and she had child immediately. And the husband passed away just 2 3 months before the girl's death. And this woman was for 15 16 years. She stayed away from all men because she felt that I'll get distracted from my child's this thing. And so what happened was she stayed away from all men. Just last year, some guy from her office became friendly with her, kind of showed some dreams to her, and she was not actually uh, open for this, but she also fell for it because she has her own emotional desires, not only the physical but emotional desires also, psychological desires, or not desires, but everybody wants relationship. Human beings are social animals. They want a relationship, friends, social life, family life, everything. And she got in a relationship with this guy who was with her for 6 7 months, and after 6 7 months she found out that this guy was also dating some other women at the same time. So when she confronted, he just said that no, no, no. First of all, he rejected, then he agreed, but he said that I'm not going to get married to you. You already have a child, and I'm not my family is not comfortable. That's why I'm seeing others. So this young woman was quite distraught. She's still just around 36 37 7 years of age, and all these many years, for her daughter, she stayed away from all relationships or remarrying. Her parents were telling that okay, you get remarried, but she was scared that okay, this man whom she's going to get married to might not accept her child, and I don't want to do that to my child. And now after so many years, she fell for some guy. She got fell in love with this guy, and she has um, broken up with her and done these things. So she was suicidal. That's why she approached me. So some of these things are happening to this level because, according to me, men in India, at least, unfortunately, are looking at single women who are 35 plus in this manner, that they want to have a fling, they want to have some, not all men, but a good number of men. And that kind of troubles these single women more. At least that's what I have seen in my patients.
Okay, that like the extension to this, Avni. Let me ask you. So, isn't it that the sex and the emotional things are two different things?
It is.
And
So
why
yes,
should we get so tabutized? I think that a man does not feel that bad if he's into extramarital affairs. Forget about the affairs in extramarital sexual relations. Why a woman should always connect that I need a father for my child, or even if she has a strong sexual desire, and then she wants to get into a physical relationship, what's wrong in it? This
so I
question, like,
feel.
might be a very, very moralistic questions, but isn't it like what we women are facing nowadays?
Yeah, but I also think that how we women are being brought up. So if you go to see like the Gen Z right now, if I take it up, not the women right now that we have as a participant, but if I compare ourselves like the Gen Z, they're very much open to having a lot of extramarital affairs or having flings. The hookup culture is there. Whereas the man don't feel bad because they are very clear in their mind that they just want sex and that is done. Whereas we women, even though we have sex, we start attaching emotions with it. Oh, this person made me feel good in my sexual desire. Now I think this person can be seen front also. So I feel that we women tend to be more emotional than men because men go more with logic. Correct me if I'm wrong, Dr. Chinmay, but I feel that men have emotions, but जैसे वो bring up किया जाता है कि no, men can't show emotions, you have to be strong. The same way we women be very emotional. So if a single mother wants to not have a father or just go and have a fling, it's okay. But हमारे values और beliefs ऐसे बोले जाते हैं ना कि we only self sabotage ourselves saying कि नहीं ये हमारे values है तो I shouldn't go out and have fun. But with men it's like ठीक है ना हो गया, that is one time thing, that it doesn't really matter. So that's how the difference comes from.
So that age-old Sati Savitri concept is still there, and the
Yeah.
virginity on a platter should be there, right? This
Yeah,
is what
yeah, yeah, and it
even
also impacts the women's mental health because we are so rigid to our values that has been given to us by our parents that we feel like कि नहीं हम कुछ गलत कर रहे हैं. And then if we start having fling or maybe one night stand, the new terminologies that keeps coming up, the women feel like, oh, this must be the person. But whereas the man don't think in that way, they think कि chalo, whatever it is, the sexual desire is completed from buddhi and let's just not think more about in the future. But we women, we start thinking more of the future rather than just thinking ki what both the partners want.
yeah. Okay, nice. This is like a very good insight. I wanted to bring this up on my platform because I see a lot of women, our audience and my friend circle also, they have a lot of guilt and shame
Yeah,
if they
yeah.
have had a physical relationship with multiple men. So now the question is basically why if men can't have it, men can't do it, why women can't? We talk about
So
equality here.
So that is also there because we women start feeling guilty about it because then we feel like what if the society starts questioning our character and identity? We don't want to be seen as bad because like in Mumbai also I've heard a lot of times कि जब 35 age के ऊपर कि women get into an extramarital affair or they just have a partner for sex, they start, their friends only start sabotaging them saying, oh तूने ये किया, but तेरा तो husband था ना, तो तूने ऐसे कैसे कर लिया? They don't understand what the psychology things go behind it. So we also, I feel like, we women also try bringing other women on the basis of characters down and by judging them why they did what they did rather than understanding why they did it.
Okay. So like the speakers, if you have any of the presentations you want to showcase, you can do that. Yeah. So I'll start with Tripti ji. So I have a question for you. Presentation? Okay. Tripti ji, you have a presentation to showcase?
Yeah, I do have a
Okay.
presentation.
Okay.
So let me
So yeah.
share my screen
Sure.
quickly. Okay, so I hope everyone can see this.
Yes.
Yes, we can. We can.
Okay, so I would like to open my presentation with this statement: sex is a beautiful gift of God. During my HIV/AIDS days, where I have a work experience of more than 15 years in the field of HIV/AIDS as a clinical psychologist, and I used to take care of the psychosocial part of HIV/AIDS, or people living with HIV/AIDS and their family members. And I've also trained many healthcare providers in counseling skills. So we were trained in this HIV/AIDS field, HIV/AIDS counseling, and this was the statement that we were taught. Our minds were conditioned with this, that sex is a beautiful gift of God, but we humans have made it complicated. Another statement that I've come across quite frequently is women give sex to get love and men gives love to get sex. That's what we discussed. We are a country. We have a culture where I'm sure many of us must have heard about Kama Sutra. The great Saint Maharshi Vatsan has given a beautiful treatise called Kama Sutra, where he not only discusses about healthy ways of being intimate during sex with your partner, but he has also depicted many different sexual positions. Now, it is said that there are as many as 84 ways of sexual positions where you can have these positions and enjoy sex with your partner. Now, I'm sure many of us may not be aware about this. We, in our culture, we also have temples like Khajuraho temples. Now, this is a very beautiful temple situated in Madhya Pradesh that reflects the idea of female beauty and fertility. Although it has less than 10% of erotic sculptures, it does have significant society in those thousands of years. It also depicts various sexual positions in an artistic manner. I would also like to discuss some disturbing facts. Women and youth are most frequent victims of sexual violence, and they suffer a great deal of sexual health consequences. Why? Again, because of the shame, because of the stigma that is prevalent in the society. Now, the irony is that parents believe it's teachers' responsibility to teach about sexual health to children in school, and teachers think that talking about sex and sexuality is basic parental responsibility. So teachers think that parents should discuss, and parents think that teachers should discuss. So in the whole process, children are being neglected for sexual education, which is very much important in their life cycle. These are some of the discussions that frequently I have seen in my clinical practice. Some of the partners says that children have grown up, so now let's stop having sex or decrease our frequency. Festival days are starting, so we will not have sex during these days. Sometimes women think that I'm a bad mother or wife or a woman because I still have a lot of sexual desires at this age. Many a times women think that what will my doctor or healthcare provider think about me if I ask questions related to sexual health or my sexual needs. That is self stigmatization. How many of us know that nearly 50% of women globally feels uncomfortable discussing about their sexual needs as well as sexual health because of stigma prevalent in the society? Now, these are the questions that I would like to ask all of us. How many of us has the courage to openly discuss about sex and sexuality with our teenage daughter or within our family? How many of you could discuss openly about your sexual needs and desires with your partner? How many of you has tried different sexual positions with your partner? How many of you could ask questions about sexual health without any hesitation with your sexual healthcare provider? So, women's sexual health is crucial for overall well-being. Silence around these issues leads to lot of misinformation that again leads to poor health outcomes, lot of mental health problems like anxiety, depression, stigma, guilt, fear, and that leads to ongoing stigma. I would like to divide myths in three types. That is cultural myths that deals with the cultural setup of the society. Religious myths and generational myths. Generational myths are the myths that passed on from one generation to another, like you should not discuss about sex within the family, open discussion should not be there, you should not discuss about your sexual desires with your husband or your partner. So these are generational myths from one generation to another, it has been passed. So instead of discussing about each myth, I would combine all the myths. So first is sexual activity is solely for procreation and not for pleasure. Whereas the reality is it's a natural and essential part of human relationship. It contributes to emotional bonding, it relieves your stress and helps in overall well-being. Another important myth was sexual areas are dirty and should not be touched. Whereas the reality is it's very, very important to maintain hygiene of sexual organs that helps in overall sexual health. Every time a woman has sex, she must get an orgasm. There's another myth. So if a woman does not get orgasm after having sex, she feels that there is something lacking in her. And that is the reason many women fake orgasm due to this myth. Of course, as Dr. Chinmay was discussing, the frequency of orgasm may reduce as the age progresses, but again, it varies from woman to woman. Another myth is women are expected to suppress their sexual needs and desires because it is seen as immodest or inappropriate. But sexual desires are natural for all genders, and even women have the right to express and explore their needs without any shame or guilt. Talking about sex, even in the context of education or health, is improper and disrespectful. That means if you talk about it with your children, with your daughter, it means you are not respecting them. Or if we see the other way around, if the children ask any question to their parents or the teachers, and the parents feel that children are disrespecting them, I feel that children are disrespected. Very essential for informed decision making, safe sexual practices, and breaking the cycle of stigma. Another thing is, here I would like to discuss one case that I came across during my clinical practice. A 45 years old female was referred for her depression. She was accompanied by her husband. Now, it took 2 to 3 sessions for her to open up and discuss about her challenges of her own sexual desire and intimacy. During the session, she informed that she got married at very young age and her children are grown up now. After the children are grown up, she informed that she is not interested in sexual intimacy because
Triptiji, I think you have a bad network. You're frozen actually.
grown up, her husband has stopped having sex. So because the husband had joined some religious group, and the devotees were taught that you have to stay as a brother and sister even if you are a husband and wife. So that was the reason the husband stopped even touching her or hugging her. After having a discussion with the husband, it was found that husband also had many misconceptions about sex. But the most important was that children have grown up, so sexual relation is not now needed. So during the sessions, she kept pleading to explain the husband to at least hug and touch her, if not daily, then at least 2 to 3 times a week. Now this was very eye-opening case for me, because then the the importance of intimacy, the importance of touch is seen over here. So there was a research article where the research was done to check the myths and misconceptions in women, and as high as 86% of men said that any woman who initiates sexual activity is immoral. Around 70% of women thought that thinking and talking about sexuality is a shame, and around 68% of women had this misconception that fantasy during intercourse is false and is cheating to your partner. So, according to the finding of this study, the belief rates of sexual myths are very high. So, it is prevalent everywhere globally. And this kind of myths and misconception pushes a woman to unnecessary anxiety in terms of general sexual health and also during sexual intercourse. That again decreases the health and pleasure level of sex. So, the way forward is comprehensive sexual health education, which is very essential component of all health professionals, because even healthcare providers, in my experience providing training to healthcare providers in sex and sexuality topic, it is found that even sexuality.
That was a wonderful presentation, actually. Lot of insights, uh, Triptiji.
Yes.
So now I have a question for you, actually. So the how can women push back all these myths and beliefs and the social pressure, and then talk about it and express their desire? How could we, like, one be, I'll say, the sexually independent, sexually empowered? We talk about a lot of women empowerment. This is something, again, like, we're putting a lot of layers to it. Okay, even like, and I am talking about it, people would be like, saying that, oh my God, she's talking about it. So now the how can one be, like, really independent sexually, and can talk about, express her desires? How could we do that?
Well, I would say that through courage, through self awareness about your own sexual needs and desires, and also through awareness women can push back the cultural stigma and pressure on them. That is very, very important.
Thank you so much. Uh, Dr. Chinmay, I have a question for you.
Mhm.
What are some common misconception about sexual dysfunction? And if you could highlight some safe sex practices about the contraceptives also. So I have come across women who has, I mean, this is really strange that, the women over 30, they have never experienced orgasm. I met with a woman, she has never experienced, she didn't even know what orgasm is. So, like,
Yeah, that is
how
called as female orgasmic disorder or anorgasmia. It's a sexual dysfunction. So I'll give you a brief some information about the main sexual dysfunctions. Sexual dysfunctions are another topic which is not talked about right now. Also, we are mainly speaking about why women are not having
Mm,
flings and these things, and they should focus more on their desires and all. But
right.
there are problems with these desires, or there are problems with the sexual life, which are clinical problems which can be taken care of by medicines, by therapies, and by exercises, or changing the mindset little bit. So around 43% women can, means different societies do have different numbers, but there are studies which have shown that from 30 to 43% women have some kind of sexual dysfunction. And these sexual dysfunctions, because they are not taken care of, causes a lot of problems in their relationships, in their marriages. And they start feeling too guilty about having it, and most of them don't know that this is a sexual dysfunction. It is not that something is wrong with them. It is just like any other illness we have, for
Right.
which there are treatments, there are uh, therapies available. So, first of all, let's understand what is sexual dysfunction. So, sexual dysfunction is inability to respond to sexual stimulation or experiencing pain during the sexual act. So, in women, this is basically the concept that you get pain during the sexual act, or you are unable to respond to sexual stimulation. uh, the causes of them can be multiple. So one of them could be psychological causes, there could be physiological causes. Physiological means hormonal changes happening in women every month, and especially post pregnant, during the pregnancy and post pregnancy, postpartum, and along with that during the menopause, or before the menopause and after the menopause. So major hormonal changes happen in a woman's body, which has direct relationship, which can have direct relationship with their sexual life. Then there are stressors. So many women, or so many men and women nowadays, our lives are very stressful lives. So these stressors also can contribute to some sexual dysfunctions. Very commonly, when we are stressed, we don't feel like having sexual intercourse. Why to have it? And it's too much of a there is too much of effort to do that. So I have seen so many women who come to for their treatment of depression, anxiety, OCD, or any other illness. They say that I don't feel like doing. Or even men also complain this thing that they don't have desire because they're in so much stress. The stress directly can reduce the sexual desires. Then there are, as we have been discussing many times, there is upbringing, cultural, social norms. They also can contribute to sexual dysfunctions. Physical, mental health, as I was telling, that somebody is going through depression, because of the depression their sexual desires go down, or they get into some sexual dysfunction. Relationship conflicts are very common to cause sexual dysfunctions. It could be main cause. There are couples who otherwise can have good in women. Uh, there are so many women who don't like their partner, and because of their marital conflicts, they don't feel attracted to their partner. But otherwise, that man might be quite good looking. And as far as men are concerned, this is far more bigger problem, because if they start feeling that they are not able to perform, then the society has put their manhood on the sexual life and all. So if they have some sexual dysfunction like erectile dysfunction or premature ejaculation, they are so much in distraught that what will happen if the society comes to know, or what will happen anybody else comes to know about this problem of mine. People will laugh at me, they'll say he is not a man, he is impotent, etc., etc. First thing I was telling, that psychological factors cause sexual dysfunctions. Many women go through sexual abuse. There are a lot of cases of rapes happening. Many of them have some type of sexual dysfunction because of these traumatic events, because they are not as comfortable with the sexual acts. Uh, Not all, but a large number of them have this problem. So the first sexual dysfunction I would like to, there are so many of them, but we'll just take up 3 4 of them who are major.
The main ones, actually,
The
main
main
ones.
ones, yeah. So female sexual interest or arousal disorder. So here, what happens is that a woman is not having enough sexual interest, or she's not getting aroused. She might have interest, but she's not getting aroused. So uh, they may have difficulty in achieving orgasm, and also might experience pain. The main complaint is that they stop having erotic feelings, thoughts of, they don't get thoughts of fantasies, decrease uh, impulse to initiate sex, or inability to respond to partner stimulus. So many times we see this thing, especially in couples in whom the male partner has little bit more sexual desires than average. That not be abnormal sexual desire, it still comes under normal, but little bit more than the average population. And the woman might get too uncomfortable because this man wants it every second or every day. I don't want to do it. So that kind of thing can lead into this female sexual interest or arousal disorder, that they start feeling that I'm not interested in this thing. It is better if this doesn't happen. Another major cause of this sexual dysfunction is this female sexual interest or arousal disorder is marital discord. Women, as Avniji was telling, that a large number of women are, or as Truptiji's presentation also had a quote, large number of women don't distinguish between the emotional and the sexual that much, which is a good thing, which is not a bad thing. At that, for them, they are more of a holistic. Their whole body and the mind is one, which is the scientific natural reality, and they go around along with that natural factual reality. So if there are major conflicts in the marriage, then many women, they don't feel that much interested in the sexual life with that partner. Then the second sexual dysfunction was, as Mona Lisa you were telling, there are women who had never had an orgasm. So this is called as female orgasmic disorder or anorgasmia. Now, there are two types here. If this woman didn't have a partner who was able to do a proper sexual act, and that's why she didn't get orgasm, then it's not her problem, it's the partner's problem. But if the partner or partners which she has had have had an reasonably normal sexual act, could perform a reasonably normal sexual act, and still she was not getting orgasm, then that could be, she might be having this female orgasmic disorder, or what is called as anorgasmia. So that is delay or absence of orgasm after normal sexual excitement phase. So the difference between the first and the second is that in the second, in the anorgasmia, they have interest and they start having, they get excited about sexual act and they are excited and they start having, but they don't reach the uh, peak of that experience. Sometimes it is absent, sometimes it is very delayed. Uh, and this happens in both the things. So even during masturbation and even during coitus. So even if they are having doing masturbation, they don't get the orgasm, and even during the sexual intercourse, they don't get it. 30% of the women have this problem. This female orgasmic disorder is there in 30% of the women, and often cause of major um, major marital discord. I had seen a woman who had both of these problems together. She has female orgasmic disorder as well as female sexual interest or arousal disorder. Initially, it started with the anorgasmia, and then later on, it went to the lack of sexual desire. And this woman was, and there is so much of this material on asexuality and all of these on internet. So she was brought to me by the husband that I am not a person who has very high sexual desire, but my wife is not having any intercourse. So this wife came and she said, I'm okay if my husband has some sexual flings or one night stands outside. I just want him to have that. I'm okay with it. He should not just get emotionally attached with someone. Okay, so then it was found out that she had some trauma, and after that trauma, uh, this thing started. These sexual dysfunction started. So once we dealt with that trauma and we went into some type of, we helped her to get over, resolve that traumatic event. Then she started having normal sexual life, and the husband was also happy. And fortunately, he didn't go out and do any extramarital affair or what, because that his morals were not allowing that. Although the wife was telling him for 2 3 years, you go out, you have the best wife in world who is okay with you going out and doing something. But he said, I can't do that. That these are not my ethics and all. So but she got better with means all both these sexual dysfunctions we could successfully treat, and they had a normal life. Now this anorgasmia can have psychological factors. So one of the main fear is fear of impregnation. This is less seen in women about 35. It is more seen in women between 18 to 30 or something, or before marriages, that fear of impregnation is so much that, and sometimes they don't have knowledge of contraception, so that's why they are scared, so they don't get orgasm because they are all the time scared during the sexual act what is going to happen. Then rejection by the sexual by the partner. Some women have hostility towards men, so that is a fashion, becoming a fashion some in some areas of the world, uh, some of the western countries and all. So this hostility towards men also, but they are straight women. So you are a straight woman and you start hating men, then it becomes a problem. So you are having sexual intercourse with a person you hate, in a sense, not that person but the man. So that also sometimes can cause an orgasm. They don't get orgasm. Then poor body image, very, I think one of the most common causes of this is poor body image. There are some women who have body image issues, hypochondriasis. So because that is also one of the causes of why they feel they have very negative self-image, that they don't feel they are beautiful. Even the partner 100 times can say, no, no, you are so good, this, that, but they don't agree with that. And they have poor self-image, and then they feel that I'm good for nothing. I'm not attractive. So how will I be able to kind of satisfy someone else? So because of that, also many women don't get orgasm. Then, as we discuss, cultural, social norms, feelings of guilt about sex can also lead to orgasm, because when they get in a sexual act, they are always in double minds. Their body wants it, but their mind, which has gotten a traditional upbringing, who has had traditional upbringing and since childhood told that this is bad, this is bad, this is bad. So they can't reach to the climax in a sense. There are very less number of chances in having not getting orgasm because of damage to vagina. Uh, Such cases are less, but they are there. So these are the two types of sexual dysfunctions. Couple of more are there, which are also very important. That's why I'll talk about them very briefly. One is called a dyspareunia. So it is recurrent or persistent genital pain occurring before, during, or after the intercourse. So these are the women who get severe pain when they start to have sexual act. Victims of rape commonly get chronic pelvic pain, and the painful coitus is because the tension and anxiety about the sexual act. That sexual act is so dreaded that you start feeling very disturbed. So this causes your pelvic muscles to get contracted. Once your pelvic floor muscles get contracted involuntarily, means you are not doing it, but it is happening. The fear is so much that the moment you start having sexual intercourse, your muscles contract. So the this causes the sexual intercourse to become unpleasant, unbearable, and very painful. So this is called a dyspareunia, where the pelvic floor muscles get contracted and you get pain because of that during the sexual. And the next one is called as vaginismus. Vaginismus is basically constriction of the outer third of the vagina. The causes are similar to dyspareunia. Uh, so what happens is that here the vagina becomes so tight, constricted, that it becomes very difficult for the insertion and intercourse. Now the problem here is, it is not only the uh, penile insertion, but even the putting fingers or putting tampons, or for gynecological examinations, there are spatulas which are put. That also becomes very difficult. There's severe pain, and you can talk to any gynecologist and they have seen many such girls and women who get severe pain during the gynecological examination. Most of them have this vaginismus. So it can be complete vaginismus or partial. So penetration is possible, but not impossible, but difficult. While in complete, it is not possible. I had one patient who was married for 3 years, and she had this thing, and it was not possible for them to have a sexual intercourse, and because of that they used to have frequent very severe fights, very severe fights. Both of them were not happy with this condition, because this girl, when she got married, she didn't know she had vaginismus, and the guy who got married also, he didn't know, because they had arranged marriage, they didn't have uh, intercourse before marriage. So 3 years they went through this, And then they came to me for this problem, and we finally found out what were the reasons. We treated her with some of the medications, and kind of she could relax at this type of sexual intercourse, and that's why she could get out. Then you had asked me to talk about contraception, so I'll just do it briefly because I think I've been talking for a very long time and it might be quite boring. So contraceptions, one of the main is the uh, barrier contraception method, like condoms, male as well as female. This is one of the best methods of uh, contraception because it protects against sexually transmitted diseases as well as it gives birth control. It is easily available, cheap, doesn't have any side effects as such. That is one. Then there are birth control pills, uh, where you oral contraceptive OCPs, oral contraceptive pills. So where you have to, there are different types of them, but usually there are hormones which regulate your menstruation, ovulation, that is controlled basically. So usually you have to take it for uh, throughout the months or at least few days a month. Then there are implants nowadays where you can put implants, and with these implants will have some spermicides. So if you, even if you have sexual act, and these spermicides will destroy the sperms, and woman will not get pregnant. Then there is emergency contraception, like in India there is iPill, so which you can take within 2 days or like maximum 3 days of the sexual intercourse, unprotected sexual act, and this can also help. But this is not, the failure rate is also good, but it's a good thing if it is the barrier method is not used and you don't want a child. Then there is vaginal ring, which also does similar thing, which reduces the chances. Cervical cap, diaphragms are there. Spermicidal tablets are there. So you can put tablets in the vagina, and it has this spermicide. So that will destroy the sperms, and contraception happens. Then there are intrauterine devices. One of them, very famous in India, is called as copper T. So um, many times, in order to, sometimes, people are not very happy using barrier methods like condoms, and so here we use these copper teas, very commonly used, especially in government hospital. I have worked in gynecology department for a year, and we were given this guideline that by the government, that we have to try to put more and more properties in women, so that is basically population control thing. So we have to first counsel her that, okay, you have had a child right now, let's put this will be there for 10 years. You have already had a couple of children, so we'll put this for 10 years, and after 10 years we can remove this. So that helps. However, it doesn't give a protection against sexually transmitted disease. Then there are injections like DMPA, depot medroxyprogesterone acetate injection, which is given once in 3 months. So it basically increases the levels of progesterone, which is and in order, with that, it reduces the chances of pregnancy. So these are basically different contraceptive methods.
So I have one question actually, which is like, and it just came to my mind. Is masturbation good or bad? Because there are two distinctive thoughts.
I don't know why it can be bad.
It says like, some group of people, they say that you be basically training your mind to be to reach orgasm by, like, by masturbation only. So
See,
like
there
when
is
it comes to
uh,
it
no,
becomes a little difficult.
No. It is wrong. The concept is wrong mainly because of lack of sexual education. Men and women, men especially don't know that women don't require the sexual penetration, insertion for getting an orgasm. Women can get orgasm merely by foreplay. And that's why men have this tremendous, burden on their head that they have to perform very well in the sexual act or the actual sexual intercourse, and this whole burden is wrong, and the burden further worsens because of the pornography. The porn star is having doing sexual intercourse for 20 minutes, 30 minutes, and I last only 5 6 minutes or 3 4 minutes. Average is 5 to 6 minutes. So how
Yeah.
is something is wrong with me that you should be doing it for 30 minutes? I get over in 3 minutes. Okay, now
Hmm.
these porn movies are not made in one go. They are made in 3 4 days and multiple sexual acts, and they are all edited together and done. So men don't know this thing that women can have intercourse without actual sexual penetration by penile penetration. So if men know this, so usually whenever a man comes to us for sexual dysfunctions, premature ejaculation, erectile dysfunctions, first counseling we do is do this, that focus on foreplay for 20 30 minutes. And after that, you go for the actual intercourse. If they do that, women will get some, or most of the women, though obviously those women who has anorgasmia, the 30% women will not have, but rest of the 70% women are going to get orgasm. So they are okay with it. I haven't met a woman who says that I want an orgasm only with the penile insertion, because that might be shown in the movies and all, but in real life it is very rare to see such things. So because of that, they feel that if you will do masturbation, you will get in a act of getting an orgasm, and your man who will last only 3 minutes in bed is not going to give you an orgasm. So the problem is here that the foreplay is completely forgotten, and it is completely forgotten that foreplay is not just start of sexual intercourse. Foreplay is part of the intercourse, and if you do
Wow.
proper foreplay, then your woman will get an orgasm. And then even if you last for 3 minutes, it's okay. Second, this myth which I think the PG's this thing was that you should not get orgasm. Also, some myth like this that woman should not get orgasm or something. Or sometimes there is a very funny myth that both of them should get orgasm at the same time, which is
Yeah.
almost means
Yes,
I don't know
absolutely.
if this happens at all or not. So, because first of all, two different people, when I am getting orgasm and when my partner is getting orgasm, how do we know? So these are the myths. I don't know why masturbation can be wrong. If it is done in a safe way, if it is done in a safe way, you don't put anything inside and then that surgical thing is required. If you don't do that, why, if a normal masturbation is wrong, it's quite normal and it is quite okay to have that. So see, if you do masturbation, and I tell this even to men. So like the case which I told, that the woman who was saying that this guy wants sex all the time. I don't want to. I'm so frustrated with sex. I don't want to have sex. I'm okay if I don't have sex throughout my life. This patient, which earlier I was telling. Now this man I told, see, you have your sexual desire. Your wife has her sexual desires. There is some mismatch. For your sexual desire, you have masturbation. What's wrong with it? You do masturbation. Your wife will also be happy. She wants sex only once in twice in a month. You want it every day. This mismatch can be managed easily by masturbation.
Okay.
But this guy says that no, masturbation is not a real thing. I said, why is it not a real thing? So masturbation, if a woman and a man have sexual means their desires mismatch, which is very common. If a woman has masturbation, she gets orgasm, she's sexually satisfied in some way, and if that is going to help her marriage or her relationship, what's wrong with it? Obviously done in a safer way.
Yes. Thank you so much. I think that we have broken a lot of myths, both psychological as well as clinical. So that leads to my question to Bibhaji. Bibhaji, I'd like to ask you, what would be how could get a body and mind aligned when we're facing changes in libido due to menopause, stress, or other factors? And how can we reconnect our body with our mind? If you could suggest us through a presentation maybe, or some safe asanas, or some mindful meditation or something, that would be really grateful.
Thank you, Mona. Mona, I want to pull the string that our discussion was going somewhat in the very elaborate discussion. And pointing out the problem is not at all the thing, is we should get the solution. The audience that are sitting here, they should get the solution of all the things. In fact, problem is being faced and solution is not being given by anybody. So as a yoga instructor and as a wellness coach, myself, Vibha Chandra, I just want to give some of the other tips, a very initial tips. First of all, the thing that you dress up properly. Dress up properly. I just focus on this thing. And the other thing is, second thing is that you do breathing practice. Breathing practice means it do not mean that you are sitting in a particular yoga posture or dhyana asana and like this. Every now and then, in the 24 hours a time, you do the deep breathing practice at least 4 or 5 times a day. 4 or 5 times. I just emphasize 4 or 5 times a day you should do. That is simple deep breathe, and deep breathing in and out, and exhalation to the maximum level. This is the second thing. And thirdly, your gut should be healthy. When your gut is healthy, then you can do each and everything in the every arena of your life, and including in the sexual arena of the life of your life. So improve your gut with the good food, with the healthy food, with the good oil. And thirdly, fourthly, not the last, but not the least, but the last thing is that you do a yoga practice. Yoga practice, simple yoga practice should be done daily. Daily means daily, at least 5 days, 6 days a week, it should be done. And not more than 40 45 minutes. I don't say do it for 1 hour or 2 hours like that. Do it only for 40 minutes, 45 minutes. And to your surprise, to everybody's surprise, I would like to say that every day the yoga practices that we used to do Surya Namaskar. But other than Surya Namaskar, obviously it is very useful. Other than Surya Namaskar, Chandra Namaskar is very useful. A very good yoga asanas, group of yoga asanas that even men should practice, women should practice for their very good sexual well-being. And here I would like to just demonstrate Chandra Namaskar, and I think it would help everybody in their act of life. We have to start. We have to start on the one side of the yoga mat. This is what is breathe in. Stretch your body to the maximum level and exhale. This is what is called Tadasana. Exhale. This is Tiryak Tadasana. Again in and exhale. Stretch your legs. That is squat position. And open your arms. This is what is called goddess pose. Goddess pose, and dip your body at least for 10 times. After doing this, just put your leg in the 90-degree, one hand down, look up straight. Your body posture should also be the body should be aligned properly. Again, exhale, down. The other position is this one. Our pelvic floor muscles in the squat position and this position is being flexible, is made flexible. Then this is what is the other one is called Dandasana. Shift to the other side and same process is repeated from the other side. Exhale down, inhale, triangular pose, and come on this one side, the other side, and do the Tiryak Tadasana again, Tadasana. Swing your body for the Tiryak Tadasana and come to the normal pose. Thank you. This process we have to repeat at least 5 to 6 times. Then our pelvic floor muscles relaxes, our body relaxes, and we are ready for the every arena of the life, not only sexual, every arena of the life. Thank you, Mona.
By the way, Bhivaji is 54 years old and she is fit and very, very flexible. This is what yoga does. She has taken a journey of being a very obese person to this. So that's like, a lot of kudos to you, Bhivaji.
Thank you,
Yes.
Mona.
Yes. Anything else to add to it, Bhivaji? You need to unmute yourself. Yeah, you unmuted. Yes.
Perfect. The only thing that I want to say that yoga is not only for the physical activity, not only for the mental activity, not only for the spiritual activity, it is for your sexual activity as well. That is very important for your social life, for your physical life, for your family life. So practice yoga daily and not, if not for an hour, practice at least for half an hour. Thank you.
So we have almost come to the end. I have one last question for Avni.
Yeah.
Yeah, so like now it comes to like how do we address these issues, the body image issues? What advice would you give to women struggling with confidence? This is something highlighted by almost all these panelists. And how can women can start open conversation? I think communication is the key here. We
Yeah.
don't talk. We don't talk. And I think the problem starts from there. We don't talk about our uh, uh, medical problem. We don't talk about our emotional problem. So, how do we address these situations?
The first that we can address is the body image issue. We women, because of the social media or women over here 35 plus years age, cannot compare their body to the other's body. You are beautiful the way you are. So, we can start practicing by self-love. I'll not go in much detail of, why body image issues happen because we all know that we compare ourselves to either the actors or the TV serials that we see. Oh, she's so thin. Why can't I be thin? And then we start doing their diet. Just a commercial ad from Shraddha Kapoor. She says, green tea pee lo, patle ho jaoge. But that is not how things work. So the body image issues for women that can be is that you should accept the way you look. Of course, if your partner says that I'm not really liking you in your body, sit with them, have a healthier conversation or communication with them. Why is that you don't like my body? In what particular way? Is there something that you have a desire for it? So one, I would like to tell everyone over here is that please accept your body the way you are because in the case you try doing all these fastings and using Lipton iced tea or something or the other, it's going to affect you physically and mentally, which will lead to a lot of physical health issues. While you are trying to, get into that shape, it is also mentally getting very taxing for you because you're losing on your self-esteem. One, I would say that, please boost up your confidence, please boost up your self-esteem. The way you can boost up is you communicate to your partner how you feel about it. In the case they accept it, it's okay. If not, then try keep on communicating in a way that they understand the language rather than you understanding their language. The second part is that we are always not open to having these conversation, as I said before. Also is that key one is our values, second is our belief. So we also have to understand where we have to stop our values and belief. Understand that, the world is changing. It's not like, we are in that bubble now. कि नहीं चीजें ऐसे ही होनी चाहिए. So it is essential to have an open conversation with your partner about your unmet emotional or physical needs. जिसे men को बोला जाता है कि you can't share your emotions. The same way women are being too emotional, we have been shut down. Oh, you can't be too emotional. Also, think from a logical point of view. We also come from this belief that women are only supposed to be working at are supposed to be a housewife, whereas now the things are changing that women are supposed to go out and work also. So I would say that, for example, if you don't accept your body the way you are, just keep on telling yourself that I accept the way I am. If you're trying to approach your partner, try having an empathetic conversation, like being that, for an example, you don't love me enough, then try saying, I've been feeling that, we have been getting distant now. Can we just talk about it? Can we have an open conversation? But if you use a word like don't, it will of course bring a lot of negative connotation. So up start कीजिए conversation by having a positive line कि this is what I am feeling rather than projecting your feeling on your partners. So this is how the open communication and conversations can happen. And in the case you feel that you and your partners are not on the same page, of course you can visit a therapist, try taking a therapy session as a couples. But this is what I can say, that women, we have to be very self-compassionate to each other. जब अगर हमारी कोई फ्रेंड बोलती है अरे मेरी बॉडी अच्छी नहीं लग रही है, तो हम उनको वही सलाह देते हैं ना कि नहीं, इट्स ओके, वील गेट देयर, लेट्स डू योगा, लेट्स डू एक्सरसाइजेस, दिस दैट एंड ऑल. Why can't we apply the same thing on ourselves? So yeah, this is all I can say is, one, we have to boost up our confidence. Second, self-love is more important because we are the way we are and no one can change us. And third is having a lot of open communication, but with a lot of empathy to our partners.
Thank you so much. Thank you so much. I'd like to ask the audience if they have any question for our panelist. Is there any question from the audience segment? Okay. Okay. So, like, one last thing I'd like to ask, what is that one piece of advice to speakers primarily, like you would like to give women about how they could redefine their sexual wellness? That one piece of advice we'd like to know.
Let me share the screen once again
Yeah.
quickly. And yes, so this is the advice that I would like to give. Breaking taboos begins with a single step, that is the courage to start the conversation. So you need to communicate, you need to be able to communicate without any hesitation. Your desires are reflection of your growth. So more the desires, that means you are growing, you are maturing physically and mentally. And they deserve to be celebrated without any hesitation. And every step toward openness chips away at the stigma, creating a world where women's voices and desires are fully respected.
Thank you. Thank you so much, Diptiji. Dr. Chinmay.
Yeah, so I would like to tell that they should listen to their bodies, uh, and they should be aware of their sexual desires, and they should be less focused on what others are going to say, or what any part of the social you know stands or fashions go. One has to understand oneself, one has to understand one's own problems and deal with them. There is no one single solution which works for everyone. So one has to find that and work on oneself, take help of the professionals, and get over with this rather than suffering in silence, not talking to to anyone about that. What will people say, and getting too much worried about that, and suffering for years and years together, because this is part of a natural your life. Just like everything else we are doing, we are breathing, we are eating, we are drinking. This is part of one of your body's needs. So one should respect that. So yeah, that would be my advice.
Thank you. Vivaji, one piece of advice.
Mona, a big milestone we have already touched, that we talked on this topic, that was not being talked publicly. So we are just winner. We just talked on this topic for since last 1 hour 45 minutes we are talking, and we are talking very coolly. So one milestone is touched. The thing that I want to discuss here is keep yourself fit, keep your partner fit, and decide the frequency of the intercourse in the month. And whenever you are in the course, whenever you are in the process, it's not that you do daily or at what is the this is the personal thing, that how many times you want to do. But when you are fit, then you will be contented in a very few minutes, very few seconds. So my thing that I want to implore is keep yourself fit and keep your partner fit. Thank you, Mona.
Thank you, Vivaji. Avni,
So the last piece of advice that I would say is accept the way you are. Please love yourself, because I know how women go through a lot of things. And me being a woman is also, I know how much taboos or stigmas or self-sabotage that we do. So a lot of self-love is required. So please keep loving yourself the way you are. Don't let others define you with the kind of body image issues that you have or anything. And please communicate openly to your partners about anything or everything that you feel.
thank you so much. It was such a wonderful sessions. Thank you, all the panelists and all the audiences who have joined us. And this, I think that we have broken at least one taboo. As Vibhaji rightly said, that we have reached one milestone, and we would be doing more. Thank you so much for being part of this webinar, giving us. I mean, we had asked for 1 hour of yours, or you are getting more than almost like 2 hours. Thank you. I think that we are blessed. We do have a community called Cup Conversations, where we held not webinars, workshops, and then eventually we do retreats also. In coming months, we would be announcing those cup conversations in multiple cities. We'll start with Delhi, NCR, then gradually probably move to other cities. Thank you so much being part of it. Do follow us on social media. Thank you. Thank
Thank
you,
you.
panelists. Thank
Thank
you.
you, everyone.
Thank you, audience.
Thank
Bye
you.
bye.
Thank you for this platform, actually.
Most welcome.